Hi. Hi. How can I help you? Yeah, you're my appointment. For 1:30. Yeah, you're right on time. That's great. I was just looking at your chart here. Yeah. Okay, well, why don't you go ahead and take a seat, and I will get some information from you, okay? So go ahead and tell me what your name and your date of birth is, okay? Last name first. First name. How do you spell? Okay. And then, right, you got your date of birth. Perfect. Okay. And why don't you go ahead and tell me just like a little bit about what's brought you in here today. Okay. And a little bit of acne. Okay. And where's the mole at? Okay, left shoulder. And your acne, where's that at? Is it like, well, yes, your face? I mean, some people get it anywhere, right? You can get it on your back, really anywhere. But are you noticing it more, on your forehead, around your hairline, your chin, your cheeks, anywhere like specific? Okay. Perfect. Okay. No, that's amazing. And do you have any allergies or anything? No? Okay. Great. Yeah, just like medications and stuff, like dogs and stuff like that. Animals, it doesn't matter, just medications. I need to know in case maybe I put anything on your skin or I prescribe you anything that could be harmful, or like maybe you're allergic to and we didn't know. Yeah. Okay. And are you on any medications currently? I also want to know if you're taking any vitamins, like a daily vitamin, B12, lion's mane, anything like that, because all of those things, they can have an effect on your skin and the way that some of the products would interact with your skin. Okay. Okay, and no, that's great. Thank you for that. Do you happen to know the dose of any of those? No, that's okay. No, it's totally fine. It's not even that big of a deal. Now, what is your current skincare routine like? What face wash do you use? What moisturizer? Do you use any serums? Do you use anything? Any topicals? Tretinoin, Captrio, clindamycin, anything. Captrio is kind of like a 3-in-1, so hopefully you're not using that with any of the other things, but if you've got anything. Okay. Okay, yeah, no, that's great. So I'm gonna go ahead. I need to do a little assessment of you. So I'm just gonna take a really good look at your skin, a good look at that mole. And then I'm gonna decide what we're gonna be doing for your skincare today, okay? Okay. Now I'm just going to yep, I'm seeing around the hairline, up here, and around your jawline a little bit. Yeah, honestly, it's not really that bad. I do see like a few like across your cheeks. That's normal. It's really not bad. You've got pretty good skin actually, but I totally see what you mean. Especially up in the hairline. And then why don't we go ahead and we'll look at that mole. So let's take like this shirt. You have to take it off. You don't have to take it all the way off, just pull the shoulder down. Okay. Yeah, so it actually, I'm not really concerned about it. Usually the things with moles, yeah, it doesn't look like super abnormal. Things that we look out for, is it like multicolored, which it's not. Is it an irregular shape? It's not. It is a little bit raised, but that's, normal for moles. So I'm really not concerned about it. We could biopsy it if you really wanted to, if you were really concerned about it. But at this time, I really don't see a need for that. Okay, yeah, we can wait. We'll just keep an eye on it. You can come back in like 6 weeks. Yeah, and then we can go ahead and get that taken care of. Just take a look at it and see if anything's changed. And by all means, if you notice any changes, please do not hesitate to give us a call and come back. Okay, so for your skin, the thing that I kind of am seeing, especially with it being around the hairline and then the jawline, so I would say it's kind of looking a bit like hormonal around the jawline, which, I mean, that's very normal. There are some things that I can prescribe you for that. The most common thing would be Winlevi. It's very thick, but it is kind of like the topical hormonal acne, thing. Some people, they get spironolactone, but that can kind of mess with male hormones a little bit. And then for females, it's just something that, it depends on the person. It doesn't always work. So Winlevi is definitely my first option. It is very thick and a little bit goes a long way. And I wouldn't start using it immediately, like every day. I would just do like once a week and then work your way up. But we can get you started with that. And I did not see that you used, I don't remember you saying that you used a retinol at all, so I think I'm going to give you a retinol as well, maybe just a really low dose one. A lot of people start with tretinoin, but that one's like a lot for people's skin starting out, and I don't want to give you too many things at once. So I'll start you with like a lower, like less intense one. Do you have insurance? Okay, great. Yeah, then the insurance will cover everything, I'm sure, and that should be fine. That's the main reason I try to go towards like the tretinoin options. It's a little bit more affordable generally. Yeah, there will be, unfortunately, a purging period with these products, so they will kind of like just bring out anything that's already underneath there, that's waiting to come out. It's just going to bring it out like right now, and then instead of over the next few weeks. So I'm saying this to prepare you. You're gonna look like a volcano is like erupting on your face. Okay, it's okay. I can give you a low dose antibiotic to help you with that, so that during this meantime, it's kind of like there's no bacteria in there. It gets rid of all the bacteria, and then it can, when as your skin is used to the products, then you're kind of like good to go after a couple of weeks. So I can give that to you. You take it every day. Very important, you take it every day for 6 weeks as you're doing the products. And again, small amounts, low doses, not every day. Starting out, you will be able to get up to that, but especially with the tretinoin, it's going to be kind of a lot at first. It can dry your skin out, so you have to be really careful of that. And did you want any extractions today? No? Okay, that's probably for the best. They can leave scarring, so I don't generally recommend it, but we do offer it here, so I just wanted to make sure. And then for your hairline as well, when you're washing your face, what does that generally look like? Like, can you show me kind of like, how high up you're going? Like, what is it looking like? Do you pull your hair back? And how often are you washing your face and washing your hair? Okay, and do you work out a lot? Do you do a lot of physical activity or anything? Okay, so that's like so totally normal. What can happen is we have a buildup of oil in our hair, and then when it's along our forehead, hairline, that's where we can see some more breakouts, just because most people don't wash their hair every single day, but then they forget to like wash all up kind of into the hairline. That part's really important because I know nobody really wants to have to like get their hair wet all the time. It's kind of annoying, especially I'm a woman, like I don't like doing that. But if you don't do that, then those oils from your hair are actually, they're sitting on your skin there, and they can cause more breakouts along the hairline area. So it's very important that you're washing all the way up there, even if you're not washing your hair every day. Yeah, you don't have to get like, just like right along the hairline. You don't have to like get back into the hair or anything. You don't have to wash your hair every day or anything like that. Just like, right here. Okay. Great. Okay, now that we've gone over all of that, I'm going to go ahead. I'm going to start on your kind of like facial products and stuff like that. Lots of hydrating things today. It is all non-comedogenic, so you don't have to worry about that. First things first is I'm going to take a little micellar water to your skin, just to like get off anything that might be around. I know that you aren't really wearing anything, but even like moisturizer or sunscreen, or just like particles from the day, or the little ickies that are kind of in the air, outside, inside. It's even if you have an air purifier, like you can't get rid of everything, right? So we're gonna go ahead and do that so that we have a nice clean base to work on. Okay. Okay. Okay, great. Yep, that looks good. And I am just going to go in with a gentle cleanser. Okay. Going with a very gentle cleanser here. Okay. Okay, perfect. And then I'm just gonna wipe that off with a new cotton pad. So just really great. Okay. So now that that is all clear for you, we're going to do a nice little hydrating mask here. This is a hydrating sheet mask. So put that on you. I'm just going to really work in the products. And we're going to go ahead and take that off into the trash for that. And I'm just gonna really, really rub those products in. Very good, very nice. So now that that's all rubbed in, we've got this serum, okay? Great. That's soaking in, so that's perfect. Okay. And then we just have this nice little moisturizer. Amazing. Your skin is looking so hydrated and so glowy and beautiful. It looks amazing. So the last thing that we're gonna do is we're gonna do a little sunscreen. So we're gonna let all of those products just kind of like soak into the skin. And I'm going to put in those orders for you. Okay. So I'm gonna put in, so we're getting clindamycin, and then Winlevi, and retinol. Perfect. Okay, so you can pick those up at your preferred pharmacy. I have it at 123 Main Street. Is that still the right address for the pharmacy? Okay, great. So that's where that's gonna go. And then you can probably pick it up in about 2 hours, I would guess. And then I will see you back in about 6 weeks. Do you want to go ahead and schedule that now, or do you just want to call us? Okay, schedule that now. Great. Okay. Do you prefer mornings or afternoons? Great. Okay. And then, so I right now am pretty open during that whole week. So what is it that you're thinking kind of for that? Monday through Friday. Yeah, I can absolutely do that. Okay. At 2:30, does that sound good for you? Okay, great. No, that is perfect. That's amazing. Thank you so much. Please have such an amazing day. Thank you for coming in, and I will see you in about 6 weeks. Okay, thanks. Bye-bye.